Good morning, everyone. Today, our topic of discussion is estimation of serum albumin. Now, I want to say few words about albumin. It is the most common plasma protein, followed by serum globulin. It is almost 60% of the total protein, and its serum concentration is 3.5 to 5 gram per dl, and it is consisting of 585 amino acid, and its molecular weight is 69000 Dalton, and albumin is produced by hepatocyte. Now coming to the functions of albumin. It helps in maintenance of colloidal osmotic pressure, and it acts as a carrier of hydrophobic substances, and it binds and transports the following substances. That's our bilirubin, hormones, just like steroid and thyroid hormone, metals, copper, calcium, heavy metals, non-esterified fatty acid, drugs, etc. It also helps in maintaining acid-base balance because it has 16 histidine residues. As it is a complete protein, it helps in nutrition. Now, coming to the principle of estimation of serum albumin by bromocassol green dye method. In this method, albumin binds bromocassol green tightly and selectively at pH 4.1 to produce green colored complex, which is measured colorimetrically at 620 nanometer wavelength, and intensity of the color is directly proportional to the concentration of the albumin. Now coming to the operational procedure. We take 3 test tubes, namely one blank, one standard and one test. In blank test tube, we put 300 microliter of normal saline, and in standard test tube we put 300 ml of albumin standard, and in test sample test tube we put 300 microliter of sample, and in all test tube we take 5 ml of working BCG dye. We keep the test tubes for 10 minutes in room temperature, and after that we take absorbance or optical density of each solution of the test tube. Suppose the absorbance of blank test tube is written as AB, and absorbance of standard written as AS, and absorbance of test or sample written as AT. Now coming to the calculation. Previously we have got absorbance or optical density of the test and blank and standard solution. Now we put the values in this formula, and we have got this formula from Lambert-Beer's law. Putting all the value, we can get the concentration of serum albumin in gram per dl unit, and the concentration of standard is 5 gram per dl is kept in laboratory. Normal range of the serum albumin is 3.5 to 5 gram per dl. If the serum albumin level is increased from its normal level, that is called hyperalbuminemia, and if the serum albumin level is decreased from its normal range, that is called hypoalbuminemia. Now first, hypoalbuminemia. The causes are impaired synthesis, just like liver disease, as liver synthesize albumin. Another cause is increased protein loss, just like nephrotic syndrome, where protein loss is through kidney. Malnutrition, malabsorption, acute illness, increased protein catabolism also causes hypoalbuminemia. Main cause of hyperalbuminemia is dehydration. Other causes are congestive cardiac failure and glucocorticoid excess.